Okay, this video is called If You Got Amalgam Teeth, dental fillings. They call them silver fillings. They're really 50% mercury. They can also contain an alloy with copper and lead and even cadmium. They're not good. Okay. Since around 1980, they've tended, especially since 1976, they've tended to contain more and more copper, which causes the mercury to vaporize out of them more quickly, which increases the likelihood of side effects. Mercury is a major toxin. High copper amalgams give off mercury vapor more rapidly. You can see a video on YouTube and other video sites called The Smoking Tooth, where an amalgam was removed from somebody and they could show mercury vapor coming off of it. It's well known that the mercury can get out of the tooth. That's well known. Numerous papers have shown that. It can cause a lot of diseases. Mercury has variable valence, meaning a variable charge on it. It could be neutral as a molecule. It can combine with mercury to become methyl mercury, or with ethyl groups become ethyl mercury, and then be nonpolar and be able to cross the blood-brain barrier. It can have a 2+ charge on it and even enter through calcium channels into cells. If a person noticed that they had a health problem starting, weeks, months, years after amalgams were placed, you should consider that to be likely related to the amalgam and get them removed. Who could remove them? You would go to the IAOMT. That means International Academy of Oral and Medical Toxicology. It's IAOMT.org, because those are dentists that are trained in how to safely remove them. It requires a special procedure to remove them. They need to, have an air filtration system in the room. They need to give the patient a nasal oxygen mask, put a dam around the teeth to prevent you from inadvertently swallowing the mercury as it's removed, things like that. Okay, what should you do if you have amalgams? And I did get some myself. There's a lot of things that can cause cavities. Avoid sweets. Don't give your kids sweets. Avoid soda pop. Avoid highly acidic things like orange juice is very acidic, so you want to avoid that. What you can do is don't chew on hard foods, because you can then cause more mercury to come out of the tooth. Don't brush over them with a toothbrush. The fluoride, and especially don't use fluoride toothpaste. That accelerates damage to the amalgams. So you don't want to do it, and it's both types of fluoride, stannous fluoride and the other type, sodium fluoride. Do not let a dentist fluoride clean your teeth or your children's teeth. Fluoride's a toxin. It has no benefit to teeth. That's all BS, okay? I went back over the study. Some said it has a small benefit. Others say no benefit. The impression I got, and I heard a lot of dentists that have studied it say it has no significant benefit whatsoever for teeth. The whole thing was a big scam, getting it into the water. I think that's just to dumb down the pros, make them docile and stupid. And it was convenient for the industry as a way to get rid of their waste product, like from phosphate fertilizers, for example. Do not grind or clench your teeth, for example, when you're weightlifting. Do not expose your teeth to hot liquids, causes more mercury to come off of them. Avoid getting new cavities, because a new cavity could break the tooth around the amalgam, cause more mercury leak, and require you to go to, new surgery. Use a speakerphone when possible. It's a small amount, but when you hold the phone to your ear, it's a low power microwave transmitter. It causes a little more mercury vapor to come out of the tooth. If you have a choice, change your house to hardwired rather than Wi-Fi. That also has, it's a small effect, but there's a little effect on more mercury vapor coming out of the tooth. I'm going to show you some papers here in just a moment. I'm just giving you a quick overview for those of you who are too busy to listen to the whole video. MRI imaging causes a real small amount, and that's a pretty insignificant thing, but I would not volunteer for any stupid psychology study that requires getting MRIs of your brain or functional MRI or something like that. What should you replace them with? That's actually a tough question. I'm in the process of trying to figure out that question, and the reason it's challenging is a lot of these other materials, even if they sound better, like composites or something, they can actually be an alloy and contain some toxic metals, okay? So once I figure out what's the best thing to replace them, I will make another video about that. But at the current moment, I am not sure, and I've read quite a lot about dentistry. It's an amazingly tricky question when you start getting into all these alloys. Okay, here's some papers just about what we were talking about. Effect of sodium fluoride and stannous fluoride on the rate of corrosion of dental amalgams. The bottom line is they're both bad. You don't ever want fluoride. You don't want anything to do with fluoride. Filter it out of your drinking water. It's a poison. It's rat poison. Wi-Fi devices increase mercury release. Okay, so here's the paper on that. Okay, corrosion of biomaterials, amalgams, corrosion resistance in oral environments. High fluoride mouth makes it worse. Okay, holding cell phone to mouth increases corrosion of dental amalgams and release. Also MRI did, like I just said. But that's a pretty small thing. People aren't exposed to MRI that often. And if there's a good reason for the MRI, I would still recommend you get the MRI. That's what I would do. But I wouldn't do it for the heck of it. You get an MRI if you really need it. I wouldn't do it for the heck of it. And I definitely would use a speakerphone whenever possible with the cell phone. This is just showing that more amalgam is released when you go for a high-powered MRI, like with a 7 Tesla magnet. That's a more powerful magnet than, for example, a 3 Tesla magnet. The standard magnet is 1.5 Tesla. Here's a lady in the Radiological Society of North America, RSNA, that the mercury content at 7 Tesla was 4 times that what was found at 1.5 Tesla. Just showing you a little more paper on that. And that's basically it. So hope you found that helpful.